Hello everyone, good day, and welcome to our channel. Today we are going to understand the arthritis, its types, causes, symptoms, and treatment options. Arthritis refers to more than 100 rheumatic diseases and conditions that affect the joints, tissues around the joint, and other connective tissues. These conditions typically involve pain, aching, stiffness, and swelling in and around one or more joints. The term arthritis means joint inflammation, but the inflammation can also affect the tendons and ligaments surrounding the joint. Symptoms can develop gradually or suddenly and may impair a person's ability to perform everyday tasks. Arthritis has some no features. Let's discuss these one by one. First of all is the inflammation. In many forms of arthritis, inflammation is a key symptom, causing redness, warmth, swelling, and pain in the affected joints. Second one is pain. Joint pain is a common feature across different types of arthritis. This pain can be chronic, long-term, or intermittent and can vary in intensity. Third one is stiffness. Stiffness in the joints is another hallmark of arthritis, especially noticeable in the mornings or after periods of inactivity. Reduced range of motion is on fourth number, and in this the affected joints may become less flexible and harder to move. Last is the degeneration, particularly in osteoarthritis. The cartilage that cushions the ends of the bones deteriorates over time, leading to bone rubbing against bone. Arthritis has many types, but in this video we will highlight only some common ones. First is osteoarthritis, OA. It is often called wear and tear arthritis, and it is the most common type. It occurs when the protective cartilage that cushions the ends of the bones wears down over time, leading to bones rubbing directly against each other. Commonly affected areas are knees, hips, hands, and spine. We can diagnose it through joint pain, tenderness, stiffness, loss of flexibility, grating sensation, and bone spurs. Second type is rheumatoid arthritis, RA. It is an autoimmune disorder where the immune system mistakenly attacks the joints, causing inflammation and joint damage. This chronic condition can also affect other organs, including the skin, eyes, lungs, heart, and blood vessels. It commonly affects hands, wrists, and knees, but it can affect other joints and organs as well. Symptoms of this type can be tender, warm, swollen joints, joint stiffness that is usually worse in the mornings and after inactivity, fatigue, fever, and loss of appetite. Third type is psoriatic arthritis, PSA. PSA affects some people who have psoriasis, a condition characterized by red patches of skin topped with silvery scales. PSA can cause joint pain, stiffness, and swelling, and it affects fingers, toes, and spine. Joint pain, stiffness, swelling, swollen fingers and toes, foot pain, and lower back pain are common symptoms of this one. Fourth one is Ankylosing spondylitis, AS. AS is a type of arthritis that primarily affects the spine, leading to severe chronic pain and discomfort. Over time, AS can cause some of the vertebrae in the spine to fuse, resulting in a less flexible spine. Early symptoms of this one include pain and stiffness in the lower back and hips, particularly in the morning and after periods of inactivity. Other symptoms include neck pain and fatigue. Fifth is gout. It is characterized by sudden, severe attacks of pain, redness, and tenderness in joints, often the joint at the base of the big toe. It is caused by an excess of uric acid in the blood, which can form sharp, needle-like urate crystals in a joint. Normally, big toe is affected by this type, and it has symptoms like intense joint pain, lingering discomfort, inflammation, redness, and limited range of motion. Sixth type is juvenile idiopathic arthritis, GIA. GIA is the most common type of arthritis in children under 16, causing persistent joint pain, swelling, and stiffness. The exact cause of GIA is unknown, but it is believed to involve a combination of genetic and environmental factors. Commonly affected areas in this type are knees, wrists, and hands. Joint pain, swelling, fever, rash, fatigue, and loss of appetite are some common symptoms. Next, we are going to know about the causes of arthritis. These may vary depending on the type of arthritis, such as certain types of arthritis like RA and AS can run in families, suggesting a genetic predisposition. Specific genes are linked to an increased risk of developing these conditions. Autoimmune response is another cause. In conditions like RA and lupus, the immune system mistakenly attacks the body's own tissues, causing inflammation and joint damage. Past injuries can lead to OA as they can damage joints over time, accelerating cartilage breakdown. Conditions like gout arise from metabolic issues, such as high levels of uric acid, which form crystals in the joints. Some forms of arthritis can be triggered by infections that cause joint inflammation. Repeated stress on a joint, common in athletes or those with physically demanding jobs, can lead to OA due to the gradual deterioration of cartilage. Common symptoms of arthritis include persistent or intermittent pain in the affected joints, which can be dull or sharp and may worsen with activity. Stiffness, particularly in the morning or after periods of inactivity, making it difficult to move the affected joint. Inflammation around the joints, often leading to noticeable swelling and tenderness. Reduced range of motion is also observed owing to the difficulty of moving the joint normally due to pain, stiffness, or swelling. Redness and warmth is also visible if someone has arthritis, as the skin over the affected joint may become red and warm to the touch, indicating inflammation. Fatigue is a common symptom, particularly in autoimmune forms like RA, where systemic inflammation can cause a general feeling of tiredness and lack of energy. Lastly, in advanced cases, joints can become deformed due to damage from inflammation and bone growths. In the last section, we're going to discuss the treatment options for arthritis. While there is no cure for arthritis, various treatments can help manage symptoms and improve quality of life. Treatment plans typically include a combination of the following. First of all is the use of medications. NSAIDs, non-steroidal anti-inflammatory drugs, reduce pain and inflammation. Examples include ibuprofen and naproxen. Pain relievers like acetaminophen can help manage pain, but do not reduce inflammation. Corticosteroids can be taken orally or injected directly into the joint to reduce inflammation. They are effective, but can have significant side effects with long-term use. Disease-modifying anti-rheumatic drugs, DMARDs, are also used primarily for RA. These slow the disease's progression and save the joints and other tissues from permanent damage. Examples include methotrexate and hydroxychloroquine. Biologics are a newer class of DMARDs that target specific parts of the immune system. Examples include adalimumab and etanercept. For gout, medications such as allopurinol and febuxostat reduce uric acid levels in the blood to prevent attacks. Second available option is physical therapy. Regular physical activity can improve joint function and reduce pain. A physical therapist can design a tailored exercise program to strengthen the muscles around the joints, maintain bone strength, and improve overall stamina and energy. Third option is occupational therapy. Occupational therapy helps patients adapt their daily activities and environment to reduce strain on their joints. This may include using assistive devices, changing work habits, and modifying the home environment to make daily tasks easier and safer. Fourth is the change in lifestyle. Weight management is important. Reducing weight can decrease the strain on weight-bearing joints, particularly in the knees and hips. Eating a balanced diet rich in anti-inflammatory foods, such as fish, nuts, seeds, fruits, and vegetables, can help manage symptoms. Low-impact exercises like swimming, walking, and cycling can improve joint function and reduce pain. Strength training and flexibility exercises are also beneficial. Stress management techniques such as yoga, meditation, and deep breathing can help manage pain and improve mental health. Last is the surgical options. In some cases, the surfaces of the joint can be smoothed or realigned to reduce pain and improve function. Joint replacement with an artificial joint is also considered for severely damaged joints. This is commonly performed for hips and knees. Fusing the ends of bones in a joint can reduce pain by immobilizing the joint. This is usually done for smaller joints such as in the wrist or ankle. Arthritis is a complex group of conditions that can profoundly affect daily life. Understanding the specific type of arthritis, its causes, and available treatments can help patients manage their symptoms and maintain a better quality of life. Collaborative care involving healthcare professionals, lifestyle changes, and appropriate treatments can lead to significant improvements for those living with arthritis. By staying informed and proactive, individuals with arthritis can effectively manage their condition and continue to lead active, fulfilling lives. In the end, I wish good health for everyone. Stay informed, stay healthy,